Hello, Year 8. This is a lesson on the skeleton. So your objective today is to identify the bones of our human skeleton. So the skeleton has three main functions or jobs. Pause the video a moment and have a little think about what you think those three jobs may be. So hopefully you've had a chance to have a discussion about what the three main jobs of the skeleton are. So the top one is support, to keep you upright. Okay, without your skeleton you would just be a jelly-like blob on the floor. The second one is for protection of your vital organs, particularly your brain and your heart and your lungs. And the third one for movement. The muscles attached to the skeleton enable us to move. So we'll be looking at this a little bit later on in this lesson. So let's introduce ourselves to the skeleton here. We may be able to get the skeleton out of the prep room downstairs and bring him upstairs so that you can actually see the 3D full-size adult skeleton that we have. We're going to start at the top and we're going to work our way down labelling the different parts of the skeleton. So you have this on page 35 in your book. So if we start at the top of the skeleton here, this is your skull, also known as your cranium. And when you're born, it's actually made up of lots of plates of bones, okay, and they're not joined together. And the reason for this is so that when you pass down through the birth canal, your head gets squeezed as it passes down, and the plates inside the skull slide over one another just temporarily, and then when you emerge, those plates start to separate again. However, you do have to be really careful with young babies when they're first born, because they have little soft spots just here on the front of the forehead and at the back of the head, and obviously those soft spots mean that if the baby had an accident, a fall, okay, and hit its skull, it could damage the brain, the soft tissue inside. Attached to the bottom, the lower half of the skull, is your jaw, sometimes called the mandible. And then your head is attached to the rest of the body via this vertebrae, this backbone. And the backbone runs all the way down the back here, okay? So another word for backbone is sometimes vertebrae or spine. We come across to the front of the chest here, and if you push your arms forward, you can just about feel these bones that run across the front of the top of the chest. They're called your collarbone or clavicle. They're very easy to break, especially when you're young, okay? So I would imagine a number of you have probably ended up breaking your collarbone. It's very difficult to set a collarbone in plaster. So instead of it being in plaster, it tends to be a not very pleasant kind of like way of being trussed up, okay, to keep the collarbone in place so that it helps it to mend. Coming off from the collarbone, at the back here, you can't see it, okay, but there's a big kind of like bone on your shoulder, okay, and the top of your back. That is called your clavicle, it's called your scapula, okay, on your back of your shoulder. And then at the tops here, we can see the bones of the upper arm connecting into the scapula here, okay. These are called the humerus. And then the lower arms, the radius is the one closest to your thumb. So if you're holding your hands outwards, okay, the radius is close to your thumb and the ulna is on the other side. We also have our rib cage, which is there to protect the lungs and the heart. So the cranium or skull is there to protect the brain. The rib cage protects the lungs and the heart, which we've already looked at. And as they come and join together, the ribs, this bit in the middle of your chest that is hard, is called your sternum or breastbone. So we're now coming down to the lower part of the abdomen, okay, of the skeleton here. And we've got this massive part of the lower half of the skeleton here called your pelvis, which isn't labelled on this particular one, but this is your pelvis. And at the back of the spine, you can see this kind of like tail-like structure. That is the coccyx, okay, that tucks underneath the back of your bottom, okay. If you land on this, it can be very, very dangerous, very, very painful. Connecting into the pelvis here, we can see the joints, okay. Connecting there is the biggest bone in your body. It is your femur. The femur connects to your kneecap, your patella, as well as then these two thinner bones in the lower leg. The tibia is on the inside of the leg, and the fibula is a very thin bone on the outside of the leg. The only bones that are left then on this diagram left to identify are in your wrist, you have your carpals, and then going up your fingers, your metacarpals, and at the very ends, the phalanges. And then we also have something very similar in our feet. We have the tarsals of your ankle bones, your metatarsals, okay, and then phalanges at the very end. So these are the digits, okay, of our toes and our fingers. So I need you to label up your diagram that you've got in front of you. And can you colour in the bones that protect vital organs in red? So that should be your skull, your cranium, this one here, and it should be your rib cage here. I'm sure you can do a much better job than me. And in some respect, the pelvis, okay, curves round, and it does help to protect the lower reproductive organs to some extent in the woman. Turn over the page then to the next page, and we're now starting to look at the lesson objective, learning to investigate how your joints move. So we can see in this arm, we can see the lower bones, the radius and the ulna, and we can see the humerus. And then we can see two muscles, the one on the top, the bulging biceps, and the one underneath is called the triceps. So in this little animation, we can see that as the lower arm moves up, it's because your biceps contract and the triceps relax. As the arm moves down, the triceps contract and the biceps relax, so it does the opposite. So you've got a passage that you've got to fill in. At any joint, the muscle has to be attached to the bone to enable it to lift. The tendons carry out this job, and the ligaments then attach the bone to the bone. Muscles cannot push, they can only pull, and they often work together in antagonistic pairs. Muscle pairs. When one muscle contracts, gets shorter and fatter, the other relaxes, gets longer and thinner. And you can feel this happening in the arm, in the muscles that move your lower arm. So hopefully you can fill in those missing words for me, please. And on the opposite page, we've got a diagram. It says label your diagram up. So hopefully you can identify this bone here, the bones of the lower arm, and the muscles. So take a moment to label them. Check you have them right. So we have the upper bone of the arm, the humerus. The radius is the one closer to the thumb, so we can imagine our hand is like this. The ulna is the one underneath. We have the bicep, bulging, and the tricep. So at this particular point, as the arm is coming up, this bicep muscle is contracting, this is relaxing. If this arm was to lower downwards, the bicep would relax and the tricep would start to contract. So this is where I want you to actually experience what the bicep muscle feels like when it's contracting. If you take your hand and put it underneath the desk, so your hand is palm side up and it's pushing up gently on the bottom of the table. Careful, don't lift the table up. Put your other hand on your bulging bicep of the arm that's put the hand underneath the table and push up gently. And what you should feel is that your bicep muscle starts to feel tight and hard. It is contracting. If you move your hand around to the back of your upper arm and feel the triceps, it feels softer, it is relaxed. Now if you put the palm of your hand flat down on the top of the Surface desk, without bending your elbow, push your shoulder down. Your biceps now feel soft, and it's your triceps that feel hard. So I need you to fill in these missing words for me, please. So the biceps to begin with feel hard, they've contracted. The triceps feel soft. Then we do the opposite. The biceps feel soft, they're relaxed, and the triceps feel hard. Sir may show you a model arm so that you can see what's happening, and we use elastic bands to represent the biceps muscles contracting and relaxing. So that is the end of this booklet, and there will be a test on this unit coming up in your next lesson. So make sure that you go back through your booklet, use Moodle to help you if you've missed any work, okay, to catch up on, to give you the best chances for revision for the test. Thank you, Year 8.